So at my children's clinic, the nurses and doctors, and I guess the people behind the scenes organising things, were really good in helping me find a date to meet with my new clinic and to meet with the new doctors. So I guess there was that great support from not only the Trapeze and the new hospital, but my existing doctors and nurses. So it was really easy to do that when I had the support in the organisation there.
With the paediatric clinicians, they were very, very supportive at the time of treatment. So they were always, looking after you and getting you to ask questions, and they'd explain everything to you. I found with the transition for me, it was actually quite rushed. So I think it's important to where you can take the time as a doctor to speak to the patient about it, to make sure they're actually ready for it, and just making sure they're asking questions about transition too, because I found as well that while they were helpful, I did fall through the system a little bit when I was changing over.
I think young people should be prepared or be starting to be prepared for transition earlier rather than later. Raising the awareness and making it become part of normal practice is really important. With the young person themselves, I would suggest probably somewhere around about 12, somewhere around that early puberty stage, to just start talking about, not so much transition, but to start talking about what I frame as adolescent medicine and an adolescent medicine approach. And an adolescent medicine approach means, instead of, as a paediatrician, largely talking to the parent about the child, beginning to talk to the child, the young adolescent, as a independent or a young person with emerging independence. And the way we talk about doing this is to A, raise it as an issue, and then B, actually start seeing the young person on their own for part of the consultation. Not when I'm ready, but when they're ready. I've worked with a couple of teams, one in particular, a respiratory cystic fibrosis team, who identified that transition wasn't working well for them at the Children's Hospital, wasn't working well for the young people when they got to the adult hospital. And I think one of the most important things you can do is prioritise it, actually make it important. And you need people at both ends. You need somebody at the delivering end, i.e. the paediatric hospital, but you equally need somebody at the receiving end, the adult hospital, to see this also as a priority and something that's important. In terms of practical things, one of the things they did that illustrates this really well is they started to do a checklist, and it ties back into that adolescent development stuff, early, middle, late. So they started to make it routine at their annual reviews that there was a checklist. And the checklist for the 12-year-olds was, are they seeing the doctor on their own for part of the consultation? Can they name their medication? And basically across the checklist, it was along the lines of beginning to, started, and the middle one was yes, no, and then the last one was tick, 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 all sorted, all done. And so that became part of the annual review. So it wasn't just how are your lungs and how's your lung function and have you been taking your medications. It was effectively, are you getting prepared to have more autonomy and more self-management skills around your disease, because you're going to need that, because you're going to go on to the adult hospital. There's some of the practical things that can be fairly readily put into place without requiring a lot of money or a lot of new personnel to really smooth the transition process. So one of the most important things about transition is planning, and one of the best ways to do that is to actually develop a transition plan. So different hospitals will do things differently. Some places have transition coordinators. Where we are in Sydney, there's an organisation called Trapeze, which has been specifically set up to help bridge the gaps between the children's hospital networks and the adult hospitals, so they can actually help facilitate this. So it's great for parents, it's great for young people, and it's great for clinicians. But the key thing would be to plan it and to have it as a process, and in a lot of cases actually having a transition plan, which can be a written document or a live document that's developed over several years. And then when the time does come for transition, very important to have a discharge summary so that the new treating team get a succinct history of the young person and their illness.